Hi, my name is Dr. Kerry Tapuzian and you're watching Ask Dr. T. Today's question is, I'm losing my vision. I went to my doctor and he told me that I have macular degeneration, and he also said there's nothing that he can do about it. Is this true? Well, it's partially true. It's true that there are no drugs, no pharmaceutical agents that can reverse or treat macular degeneration for that vision loss. It's also true that there's no surgery that can be performed. But fear not, there are still treatments that can be performed to stop the vision loss and even reverse it, and that's what we're going to talk about today. Now, macular degeneration, what that is it's the loss of vision in your central field of vision. And I'm going to show you a picture here that sort of depicts that. So if we get the camera just to focus in on this picture, you can see that where you're actually focusing your vision on becomes blurry, but everything else still stays clear. This is occurring because there's actual damage to the retina. So let's talk about some of the studies that actually shows that you can stop and reverse macular degeneration. The first study is called the ARED study, A-R-E-D, which is age-related eye disease, and they actually showed a 19% decrease in vision loss, okay? And all they did was they treated with these supplements: vitamin C, vitamin E, beta-carotene, zinc, copper in these amounts. That's all they did, 19%. And by the way, macular degeneration is one of the major causes of blindness for people over 50 years of age. And I'll show you in a few moments here that it's also more of a risk factor in women that are going through menopause. So the second study that came out was called the HALE study, H-A-L-E. And this study showed that just by following a Mediterranean-style diet, that you could also decrease the amount of vision loss. Okay, so this is basically lifestyle changes and vitamins so far that we're talking about to improve your vision. We're going to go to the next page here. The next study was called the LAST study, L-A-S-T. And in this study, what they did was they increased, they put two new supplements in, lutein and antioxidants, like they were in the ARED study, vitamin C, vitamin E, etc. In this study, they actually showed not only did it stop the macular degeneration, but there was also an improvement in vision, okay? The next study was called the TOZAL study, the T-O-Z-A-L study. Same thing, they showed an improvement in vision just by adding these three nutrients: taurine, which is an amino acid, omega-3s, which are the fish oils, and zeaxanthin. Now, going back to lutein, what foods are high in lutein? And I've just put a few examples down here: papayas, spinach, mangoes, kale, collard greens. All these are high in lutein. Just as a general note, thinking that foods of the rainbow, okay, foods that have the different bright colors, would be foods that are high in lutein. Going back to women that are going through menopause, 2/3 of macular degeneration occurs in these women. And why is that? Well, the reason is because of the low estrogen levels causes women to have a lower HDL, which is your good cholesterol. And what you have to do is you have to think of that HDL sort of as a taxi cab. Your body uses HDL to take these different nutrients, specifically lutein, to your eye so that it can have the positive response. If you're going through menopause and you have low HDL levels, then there's no way for these nutrients, including lutein, to get to your eyes. And so that causes this risk factor here. All right, there are a few other risk factors. Smoking is a big one. You got to make a decision, either stop smoking or you're just going to, it's just a higher risk factor for macular degeneration. Also, unfortunately, the different drugs that are cholesterol lowering is also a risk factor for the same reason as above up here with the HDL. And poor digestion. I mean, just think about it. If you're eating all these good foods, but you're not able to digest the foods correctly because you're not making enough acid in your stomach, or you're not making enough enzymes, which happens to all of us, unfortunately, the older that we get, you're not going to be able to get those nutrients to the parts of the body, like the eye, that you need. Now we're just going to change the subject real quick, and because we have a lot of people that ask us about dry eyes too, so I thought I'd just quickly mention about the treatment for dry eyes, because this is also a very common symptom that people have. And these are some things that you can use for the treatment of it. Again, hormone replacement, natural or bioidentical hormone replacement, including testosterone, is very important to treat dry eye syndrome. The synthetic hormones unfortunately make it worse. So if you're on any of those, it's not going to help. Fish oil and borage oil is also very helpful for dry eye. Vitamin A and zinc are also two other nutrients that have been shown to improve dry eye symptoms. So are there any questions out there? There's one right there. Well, you can email me at askdrt@gmail.com, or you can go to our new website, which is still under construction. It's askfordrt.com, 4 as the number. My name's Dr. Kerry Topouzian, and you've been watching Ask Dr. T.
Hi, I'm Emmett Smith. As an athlete, I know how important it is to protect yourself from injury. That's why I've teamed up with the American Association of Orthodontists. Wearing protective gear can reduce the risk of injury and keep you in the game. Help kids play it safe.
Hi, my name is Dr. Kerry Topouzian, and you're watching Ask Dr. T. Today's question is, I have arthritis. How do I treat it? Well, osteoarthritis is also called degenerative joint disease or degenerative arthritis. It's basically caused by destruction of a cell that's called a chondrocyte. And this cell is found in cartilage, okay? And what it does is it remakes your cartilage. It regenerates cartilage. So what happens is you destroy this cell that's called a chondrocyte, and then you can't make more cartilage anymore. And eventually your cartilage whittles down from wear and tear, and you need a joint replacement. And your arthritis just continues to get worse. So the basic way that you treat osteoarthritis is you want to protect the chondrocytes, these little cells in your cartilage, and you also want to decrease inflammation, okay? So let's just talk about some of the causes, some of the things that will cause the destruction of these cells. Trauma is a big one, okay, being from sports injuries or motor vehicle accidents. Diabetes is a risk factor. Hormone imbalance in women when they start going through menopause, or in men when they start losing testosterone levels later on in years. These are also risk factors to have destruction of these cells. Inflammation again. Overweight, obviously, you're putting more of a stress on your joints if you're overweight. And then there's two deficiencies, a vitamin D deficiency and also selenium. Both of these put you at higher risk of developing osteoarthritis. Now, again, treatment, pretty straightforward. Weight loss, balance your hormones, reduce inflammation, protect the cells, the chondrocytes, and we'll talk about how to do that. And also, obviously, replace vitamin D and selenium, okay? Now, I'm going to shoot over here. These are the top 5 supplements that we recommend for osteoarthritis. Fish oil being the #1 choice, or omega-3 fatty acids. And what will happen a lot of times is I'll be talking to patients about this, and they'll say, oh yeah, I take fish oil. And I say, oh okay, how much do you take? And they'll say, well, I take a capsule a day. Well, 1 capsule a day of fish oil is not going to result in anything. You really need to take a lot more. I tell people that they have to take at least, if they have osteoarthritis, they need to take 4 to 6 capsules a day of fish oil, and a pretty potent one too. Or what's even better is you just get the liquid and you take a tablespoon once a day. I mean, you've really got to take a large amount of fish oil for it to do any good with this, okay? The other supplements, MSM, okay, which you can find at most health food stores, and the dosing for this is about 2 to 4 grams. Glucosamine is another substance that you would take about 1.5 grams a day. And then the combination of boswellia and willow bark is also very helpful. They're anti-inflammatory. And boswellia is actually also known as frankincense, okay? Going back over here to some other treatments, If you have osteoarthritis, you should stay off the nightshades vegetables. About 15% of the population are sensitive. And those are green peppers, potatoes, zucchini, did I say tomatoes? Tomatoes and eggplant, okay? Topical glucosamine, okay, it's this supplement that's over here, but what we do is we write a prescription and have a compounding pharmacy make it as a cream that you can use on your joints. Very effective, very helpful. The last one here is hyaluronic acid. This is a substance that's found naturally in cartilage, and there are prescription injectables. It's an actual injection that goes into your knee that are on the market. One of them is called Hyaluronic. It's not really a drug, but it's very helpful for osteoarthritis. It's made from rooster combs. Again, it's naturally found in cartilage and joints, not a drug. It basically what it does is it lubricates and it protects the joint. And you can do these injections every week for about 5 weeks, and it can be repeated every 6 months. They've done 25 million injections worldwide, but unfortunately only can be used in the knees. Now I'm going to add in one more folk remedy for treating arthritis, and it's white raisins and gin. Basically what you do is you take white raisins and you soak them in gin for about 8 to 10 days, and then you ingest about 8 to 10 of the raisins a day, depending on how bad your arthritis is. And I don't necessarily recommend that you drink the gin. I'll leave that up to you. Any questions out there? Ah, there's one. Well, you can email me at askdrt@gmail.com, or you can go to our new website, still under construction. It's ask4drt.com, the number 4. My name's Dr. Kerry Topouzian, and you've been watching Ask Dr. T.
I'm a big believer in the power of we. It's time for you to raise your hand. Go to serve.gov and get involved in something you believe in.
We weren't born to follow.
Are you with me?